Every day we're faced with making so many different decisions, and medicine is really complex and decision-making is really complex. And what MDCalc does is it allows us to better understand all of these models and tools and calculators that are all in one place to really help facilitate our decision-making and inform us when we're taking care of our patients every day.
Even though I'm a doctor, I'm only human, and I can only store so much information in my brain at once. MDCalc allows me to go to the app or the website and actually put in information that's specific to my patient and use a score to help make a decision.
What calculators do is they allow you to, at the point of care, make the most appropriate decision at that time. And they do that in a number of different ways. Some is for risk stratification, for what's the likelihood this patient has this condition, and therefore what's the most appropriate test, if any, to further work up that condition. Or, based on this diagnosis, what's the most appropriate treatment for this patient? So they really help with a variety of different things, but it is truly at the point of care, what should I do in this moment? And having that go-to resource that is very accessible and that you trust is really, really important, and that's MDCalc.
We have over 850 tools, all different clinical scenarios. So you can imagine clinicians in their day-to-day work are making tons of different decisions, and more of those decisions there are tools for. So there's an opportunity to use MDCalc many, many times a day.
I think most people don't really understand how complex medical decision-making is, and in order for us to integrate evidence-based medicine and all the latest studies and trials that are coming out, we really need these tools. These are not judgment decisions. There are actually really robust guidelines that tell us exactly what to do and how to do it and at what threshold. And so these calculators are a really great and objective way for clinicians to understand your risk and make sure that we're providing the best care for you.
When someone comes in with a stroke to the emergency room, and a neurologist usually goes to the bedside to figure out, is this person having a stroke? How severe is the stroke? We determine treatment options, we determine prognosis, we talk to the family, we talk to other clinicians about, whether they should come in to help treat the stroke from home or from elsewhere, or should we send this person to another hospital? So all of those decisions have to happen within seconds, within minutes. It's nice to have a place where I can go input all those components, get a score, and based on that score, I'm able to make all of those decisions and do that in minutes.
I trained at Indiana University, where on faculty we had Jeff Klein, who is the creator of the PERC rule. And I remember him saying, don't try to memorize this, you should look this up. I created the rule and even I look it up. That point really stuck to me. And that's when I really remember using MDCalc as a resource, because the user interface is so great and just at the point of care, it's so easy to look these rules up, which is exactly what the creator of this rule was even advocating for.
We all have to understand the complete package of the patient. Joe and I are both ER doctors. Stuff rolls into the ER all the time that we are not necessarily experts in, but we have to fundamentally understand how that organ works, how that disease works, what this medicine does. And so we're doing stuff often way outside of emergency medicine because we know the treatments we're going to give or the diseases we're diagnosing are going to have major impacts on their other body systems and every other piece of their lives too.
As a gastroenterologist, of course, I'm really excited about the GI tools that are in MDCalc, but the reality is that patients don't just have one system. They're not just having their gastrointestinal system. They have so many other factors in their body, and that's why I have to use many tools outside of my specialty every day for MDCalc. For example, last week I was taking care of patients in the hospital, and I saw a patient who came in with bleeding because they were on a blood thinner. And so I used a very common tool called the CHADS VASC score. Now you'd ask, why would a gastroenterologist be using a neurology score? But that's because they're on a blood thinner to prevent stroke. And it's really important for me to understand what are the trade-offs and risks and benefits of stopping that blood thinner, which has now led to bleeding. And I had to do the endoscopy and stop an ulcer from bleeding. So there are so many different scores that we use to better understand all of the decisions that are going into treatment for our patients, even if they're outside of our field. I find myself reaching for many of these scores every day. MDCalc has a really unique feature, which is that it brings together science and clinical care right in the palm of your hand.
I can pull it up on my phone. I can pull it up on the computer that I'm working on. I will sometimes even do the calculation in front of a patient and say, this is your risk of a bad outcome. And being able to quantify that at the bedside and share that with the patient and make a decision with the patient for what they want to do, it's invaluable.
So what's interesting about MDCalc is that clinicians use it not just once per day or once per patient. It's actually throughout the course of a patient's hospitalization and also multiple times per day as we're making multiple decisions. And the reason that we use it is because it's easy, simple, and supports our decision making. And that's why we see clinicians around the world using MDCalc, and really shows the power of our platform to promote evidence-based care at the bedside.